Today we are doing Botox for masseters as well as for the glabella and the forehead. So Botox you can use in many places. A lot of people don't know that you can use it in the masseter muscles to help with headaches, grinding. It can save your teeth if that enamel is coming off because they're constantly doing this at night. So I've been through a night guard or two and I have my masseters done. So, if that is a problem for you, Botox them. There's different amounts of Botox that we can use for masseters. I always start at least 30 units per side and it can last you for a whole year. So dose equals duration, and the masseter muscle is pretty large, so we do bigger doses there. There's other places to do Botox as well. So between the eyebrows, that's called your glabella. Other people call it the 11s. Some people call it the 1. But there are 3 big muscles there that we can paralyze with Botox. Your forehead muscles, we could paralyze. I would show you, but I can't really move because I'm all Botoxed up already. This is as much as I can furrow, and this is as much as I can raise my eyebrows. You can also do crow's feet to help with the squinty lines. You can treat these muscles here, the DAO, so you can't frown. I don't know if I'm frowning, but again, all the areas that I do. But masseters can help with your teeth, and then this just helps you feel prettier and also helps prevent these lines from getting deeper. So I'm going to show you a typical injection for these areas that we're talking about. So I've already drawn our patient's masseter muscle on this side. So I'm going to have you grind for me one more time. Okay, perfect. Ready? 1, 2, 3, here we go. And you're doing okay? Awesome. And like I said, dose equals duration. So that's it. Was that you? That wasn't.
It doesn't hurt at all.
Perfect. That's what I like to hear. All right. And I'm going to have you just hold a little gauze right there for me. I'm going to go to the other side and give me a grind again. Good. Perfect. I always like to confirm before we go in. Here we go. Awesome. Awesome. Great work. So simple masseter injections. Sometimes people's masseters are bigger on one side than the other, so you can tailor the dosing, obviously. I'm going to do the glabella. So I'm going to just balance right here. Start over your left eyebrow. Ready? 1, 2, 3. Here we go. You're doing great. Here we go again. So good. On the other side now. Boom. Excellent work. One more here. So great. And in the middle. Perfect. And now we're going to do your forehead. I timed myself the other day and it took me 47 seconds to do between the eyebrows and the forehead. I was very proud of myself. Okay, ready? 1, 2, 3. And up here. So it's kind of nice that it doesn't have to take forever. And a lot of people are very nervous about getting Botox for the first time. So when it goes so fast, then it tends to be a little bit more reassuring. And then one more here. So after Botox, you will want to do some facial exercises. So that means you're going to grimace and you're going to raise your eyebrows. Yep, for about an hour. So every time you stop at a red light, do 3 of those kind of facial exercises for an hour. You might do it anyway because you might be behind somebody that annoys you and you'll do that naturally. Or if you have any kids at home, lots of times that will be natural too. But just for an hour. And then the other important thing to do is to not push on it for about 3 to 4 days. So if you're going to get a massage tomorrow, put the cradle up here. Don't push on it right on the forehead. If you like to wear tight hats, don't, because we don't want to push any of that Botox down. And that's pretty much it. A lot of people talk about not going and laying down for 4 hours and exercising. Really, my most important thing is just don't push on it. I can because, I'm just wiping away the little tiny blood, but I don't want you to sit there and go, oh, this hurts so much, because it really doesn't. So you have little bumps there, but you might have those there for about 5 to 10 minutes, and then those are gone, and then nobody's going to know what we did. It'll be our secret until you just look better and better and better. And then, so it can take anywhere from 3 to 4 days to kick in, and then it can last you for up to 2 weeks to kick in, and then it can last you for 3 to 4 months. So dose equals duration. If you're doing half dose though, it's not going to last you as long, and the results aren't going to be quite as great. So there are FDA recommended doses for each area, and that's what I would recommend that people do. This area is usually 20 units, foreheads typically 20 units, and crow's feet are 12 units per side. So anyhow, I mean, that's my whole spiel. So if you want to learn if Botox is right for you, you can find us online at RejuvenationMD, medspa.com.